Hello everyone, my name is Dr. Brian Caranto and I am one of the UB General Surgery residents, and I'm also the co-founder and CEO of TraumaCode Incorporated. Today, I would like to introduce our flagship product, TraumaCode, an immersive virtual reality simulation platform for healthcare training and certification. But before I spend any time talking about our incredible product and the important market we're addressing, I think it's essential to communicate who we are. We are a team of surgeons and programmers driven by a common mission to disrupt and elevate healthcare training for everyone, everywhere, using virtual reality. The problem we're addressing exists in every hospital across the country. Each hospital has a complex workforce of physicians, nurses, and allied healthcare professionals, and it's much like running a small city, but everyone has potentially dangerous tasks that they're allowed to perform. And although we all spend a lot of time going to school, at the end of the road, there are still nationally recognized certifying examinations that assess both our medical knowledge and our clinical. However, not much has changed with these certifying exams in the last 40 years. They still remain time-intensive, labor-intensive, old-fashioned, and overall of low value. On top of that, each sector within the workforce has different requirements, and maintaining them all is a bureaucratic. This problem is further amplified when you realize that certifications are not the only requirements healthcare professionals have to maintain. We also have to pursue continuing medical education and learn new products as they come. The markets that we're talking about are large, with certifications representing over $200 million throughout physicians, nurses, and allied healthcare professionals, over $25 billion in continuing medical education for just physicians, and an untold number of billions of dollars being spent on product training by large biotech firms. Over the past 6 months, we've built a VR app that delivers a highly immersive, interactive narrative experience to our users and allows administrators deep insights from our analytics platform. We use a specialized camera as opposed to computer graphics to easily generate highly immersive environments, and the end result is a choose-your-own medical adventure. Our business model is relatively simple. We will offer via our e-commerce platform VR headsets that are preloaded with software, and we'll sell them both directly to other businesses and directly to consumers. Purchasing our software will allow account holders and individual clients to access our cloud-based marketplace of certifications, continuing medical education credits, and product training modules. But generating this content isn't easy, and first it must be planned out, produced with VR film, and then finally validated with a clinical trial. We have our MVP nearly completed, and this year we plan to roll out to our local implementation partners at UB, ECMC, and Duville. Next year we'll focus on attracting our first customers at regional academic medical centers, and afterwards build traction, scale rapidly, and ultimately go global with a plan to pursue the international. This year, we plan to raise enough money in order to film and validate our first real certification module and get it on the market. Next year, we'll seek to raise more capital in order to build and validate more certification and continuing medical education modules. After we have proven ourselves able to build and validate these modules, we will then grow a sales force and begin attacking the market. As you see here, we'll break even at just 0.5% market share and grow rapidly afterwards. Space does have competition, but our biggest competitor is actually the status quo. Also, VR and BioFlight have proven that VR can be used for healthcare education, and Striver and Pixo build VR for corporate training at the Fortune 500 level, and aren't in healthcare yet, but if they are, soon we'll be in trouble. Much like our rollout plan, we also have a number of milestones, both in business, product, and financial, that we're trying to accomplish over the next 5 years. As you see, we've already accomplished a number of these milestones for our first year and have a plan to make repeatable processes so that we can keep hitting our goals. Our founding team includes myself, Jinwei Hu, and Vito Galvez, and throughout the course of the Panasci competition, we've added Ashley Levine, an MBA student and co-surgical resident with me, as well as Aiden Shi, a dedicated full-stack engineer. In addition to our strong leadership team, we also have a strong advisory board broken down into clinical, technical, and business development verticals. So why invest in TraumaCode and why now? Well, there's four major reasons. The market's right, the team is right, the product is right, and our distribution channels are right. The market is ready now for VR technology that's designed for the physician or healthcare provider, and the technology is ready today. Our team is capable. We have both surgeons and programmers at the helm, and the surgeons are cross-trained in other fields as well, and our programmers are top-notch UB students. Our product is incredible for just the small amount of money we've invested. With under $5,000, we've already developed and deployed a VR app, a back-end analytics web architecture, and we've built a novel VR camera apparatus for capturing immersive operative video. The distribution channels also make sense. By leveraging existing e-commerce platforms to sell the products and the existing Oculus store to do the microtransactions, we've got a winning solution here. Thank you for listening to our pitch about TraumaCode. We hope that you've thought a little bit more about VR and its potential implications for healthcare training, and we'd like to invite you to come and try out the product for yourself at any time. Just get a hold of us at the link below, traumacode.de, for our website, and we'll be happy to demo the product in person. Thanks a lot, and looking forward to seeing you in VR.